Ladies and gentlemen of the Joint Convention, it's my distinct honor to present to you the Honorable Bill Haslam, Governor of the great state of Tennessee.
Good morning. Thank you. Thanks. Thank you very much. Please have a seat. Let me start by saying I really appreciate the opportunity to be here this morning. I am well aware this is an incredibly busy time for you all, and I am grateful for the opportunity to come before you today. It's the first time I've asked to do this outside of the state, and I won't ask to do it often. But I asked for this opportunity this morning for a very specific reason. There is no more important issue or more complex issue facing the state today than health care. And I wanted to update you where we are regarding the idea of expanding Medicaid. You know, this may look like a simple decision. For some, it's the biggest no-brainer of all time. The federal government is going to give us money. More people are going to be covered. How in the world could you say no? Other people say, you're right, it is the biggest no-brainer of all time, but it's the opposite. Why would we be accepting funds tied to a health care plan that we know the federal government can't pay for over the long term? I would answer it's not quite so simple on either side. Let me start by saying there are two basic reasons that I don't like Obamacare, the Affordable Care Act, however you want to refer to it. The first is cost. Regardless of what we decide to do in covering any additional people, the Affordable Care Act will cost the state of Tennessee an almost $2 million additionally over the next 8 years. Let me be really clear. That's regardless of whether we decide to cover any new enrollees. That will cost us almost $2 million over the next 8 years. Secondly, and maybe even more importantly, it doesn't address the real issues of health care reform. Users and payers not being aligned and providers and payers not being in alignment. When you go to the grocery store, there's a shopper, a product in the store. The shopper knows what the store charges for each item and pays for those items when he or she checks out. But with health care, shoppers go to the store, they pick out whatever they like, sometimes with a representative of the store suggesting additional items, and then go to check out knowing that someone else will pay the bill. Governor Bredesen made this comparison in his book, Fresh Medicine. The shopper also rarely knows what the store is charging. Only in health care do we buy something without first knowing the cost. On the provider side, providers are paid based on a fee for each service or product, not on an outcome of care. Market tension is what controls cost and promotes quality. But there is no market tension when you buy or sell health goods and services. To me, the scandal of the Affordable Care Act is that it doesn't significantly address cost or alignment reform. But that's what Washington does. It looks at a complex problem, realizes that some people aren't going to like the changes, and as a solution decides to spend more money. So many of us are tempted to say, well, that's right. Washington created the problem, let them fix it. But it's not just their problem, it's ours. I say that for several reasons. First, we all know that in Tennessee we have serious problems with health care. Second, we should all realize we're doing a better job than most of the rest of the country in controlling Medicaid costs now. Darren Gordon and his team at Tenncare have really kept our percentage increases at about half of the national average. But it's still taking a larger and larger percentage of our budget. Third, all of us have met with people across the state that live in our districts while we've been campaigning. These are folks who we know don't have health coverage and whose families are in incredibly difficult positions and that we all agree should have coverage. A lot of us in this room have a real concern for those folks that the Bible refers to as the least of these. Fourth, our hospitals. And I know it's harder to identify with the image of a struggling hospital than a struggling Tennessean, but they've been put in a very difficult position by the Affordable Care Act as well. They are losing many of the funds which they receive to provide health care for our state's indigent. While many hospitals can survive this, I'm convinced that several of our hospitals will be left in an impossible situation and will not survive this transition. Some of our communities, rural and urban, could very well lose their community hospital. Fifth, Tennessee businesses could also pay a steep price. In addition to the myriad of taxes and the fees associated with the Affordable Care Act, our businesses stand to lose $50 to $70 to $80 million a year. Sixth, and finally, there's at least $20 million a year at stake for our local governments who currently take responsibility for indigent care in our community. Let me read you a quote. "Soaring healthcare costs make our current course unsustainable. The ever-increasing cost of Medicare and Medicaid are among the main drivers of enormous budget deficits that are threatening our economic future. In short, the status quo is broken, and pouring money into a broken system only perpetuates its inefficiencies." Do you know who said that? It was President Obama in 2009. Unfortunately, his plan, in my opinion, was reform in name only, and it's costing us a lot of money. That's why a lot of us in this room don't like this plan. But I believe it's also all of our job as leaders, not just to say what we're against, but to pursue real health care reform here in Tennessee. It's our job to say what we're for in terms of addressing the biggest issue facing us. For the last several months, I've been working toward a Tennessee plan for health reform to change the way that health care coverage looks in Tennessee. I understand those who think, well, I understand those who don't think it makes sense for us to just say, well, Tennessee is not going to accept the federal dollars because we don't like Obamacare. But this state also has nearly 20 years of experience providing health care coverage through a Medicaid managed care program, and we're all too familiar with the rules and restrictions that prevent us from operating the program as efficiently as possible. A pure expansion of Medicaid, expanding a broken system, doesn't make sense for Tennessee either. That's why I've been working toward a third option, to leverage the federal dollars available to our state to transform health care in Tennessee without expanding our Tenncare roles. I'd like to put in place a program to buy private health insurance for Tennesseans that have no other way to get it than by using the federal money. I fundamentally believe that people having health care coverage is better for our citizens and state than people not having health care coverage. This plan would include copays for those that can afford to pay something so the user has some skin in the game when it comes to health care incentives. We would work with providers to lower the cost of care and to move from a model of paying for every service, regardless of the result, to a payment method that is based on outcomes and quality care. Our plan would have a definitive circuit breaker or sunset that could only be renewed with the General Assembly's approval based on when the amount of the federal money decreases. During that period, when our costs are covered 100% by the federal government, we'd work with our medical care providers to implement true payment reform. I'm confident that working together, we could truly reduce medical costs. We'd have a one-time opportunity to encourage their cooperation because healthcare providers will know that for the next 3 years, a portion of the population, which had previously been receiving services with no reimbursement to the hospitals or doctors, will now have insurance. But those same providers would clearly know that the coverage for that population will go away unless that they can prove to us that at the end of 3 years, when we start paying a percentage of the costs, the percentage of the cost of the new population, our total costs would stay flat. That's a high bar for our providers, but I'm convinced they can do it. And my conviction is based on the fact that the hospitals and medical providers have put a lot of sincere effort into working with us toward payment reform. I cannot emphasize enough how much I've been impressed with our hospitals' willingness to work with us. But to succeed, we also need the cooperation of the Department of Health and Human Services in Washington, and we can't get the same assurances from them at this point. Until we get those assurances, I cannot recommend to you that we move forward on this plan. Our budget amendment will not include language to accept the federal funds. There are a lot